Hi, I'm Nurse Megan, and I'm here to give you a report on Mr. Robert Hall. He's an 80-year-old male who presented to the emergency department this morning after a fall. He was trying to get out of his car and he got dizzy, and the garage started moving, and he fell after that. His daughter found him a while later. When he arrived here, he was complaining of 10 out of 10 pain in his lower left leg. And he also said that he has swelling in the lower left leg that started earlier this morning. And then he has been diagnosed with a deep vein thrombosis of that left leg, dizziness, and a fall. He has a history of an enlarged prostate, hypertension, urinary retention, osteoarthritis, and recurring heartburn. He denies having any allergies to medications or seasonal allergies. He reports taking 50 milligrams metoprolol a day, and his last dose was this morning. He also takes 5 milligrams of finasteride for his enlarged prostate. His last dose of that was yesterday morning. He also takes Benadryl for sleep occasionally. He has a prior history of falls, and he's had 2 in the last 6 months. He has also had unintentional weight loss of 10 pounds in the last 6 months. Mr. Hall's vital signs show his low blood pressure with readings in 90s over 60s. All of his other vital signs have been within normal limits. He reports lower left swelling of the leg that has gotten worse. He reports the 10 out of 10 pain in his lower left calf, and he describes it as nagging and also sharp. He has also reported warmth in his calf. He has been given 325 milligrams of acetaminophen for pain, and now his leg pain is a 2 out of 10. His left leg is swollen, red, and warm to the touch. He has decreased pedal pulses in the lower left foot at about a 1+. His right leg has no abnormalities and 2+ for the pedal pulse. His left leg, hip, and knee are bruised from his fall this morning. He's alert and oriented ×4. He denies hitting his head this morning. He has no signs of active bleeding. He gets dizzy when standing, and he has an unsteady gait. He states that he uses a cane at home when walking. His heart sounds are normal with S1 and S2 sounds in a regular rate and rhythm. His lung sounds are clear in all the lobes. His bruising on his left hip, leg, and knee, and other than that, all of his skin looks good. Carotid arteries look good with no abnormalities. He denies chest pain, shortness of breath, nausea, vomiting, confusion, and any other pain other than the lower left leg and where he fell this morning. His cognitive exam was normal with no concerns, and when we went through his home medication list, he's been taking 50 milligrams of metoprolol instead of the prescribed 25 daily. I recommend starting him on anticoagulation therapy for the deep vein thrombosis. I also recommend doing an ultrasound of the other leg to check for any blood clots that might be there. I also recommend close observation for a possible pulmonary embolism or a stroke. I would also closely monitor his left leg where the blood clot is to make sure it's resolving and not moving somewhere else in his body. I would also look at his home medication list and address the issue of him taking double the dose of his blood pressure medication, which could be contributing to the dizziness he's feeling. I would also consult physical therapy and occupational therapy to help him with his balance and gait and to get him up and walking around a bit. I would make sure he goes on a walk a couple times a day around the unit. I would also continue pain medications such as acetaminophen for his lower left leg to keep the pain under control. I would also implement non-pharmacological pain management methods such as guided imagery and distractions. If you have any questions, let me know.